So at this ASCO meeting, we are presenting the Accelerate study on behalf of Dr. Natasha Lake and the rest of the co-authors. And this study is trying to explore the use of liquid biopsy to accelerate time to treatment in patients with advanced lung cancer. We know that molecular profiling of tumor tissue is the gold standard for treatment decision making in advanced non-small cell lung cancer, but molecular profiling results from tumor tissue are often unavailable or delayed, and those wait times are sometimes challenging for patients in terms of anxiety, uncertainty, and symptoms. Indeed, there are some patients that are not able to get targeted therapy for his advanced lung cancer because they deteriorate very fast. And for most of the patients, when they meet the medical oncologist at the first consultation, they do not have the full molecular profiling results. And we have the liquid biopsy, which is the detection of circulating tumor DNA in plasma, which we know is a minimally invasive tool that can detect molecular alterations in advanced lung cancer. And we aim to explore the use of this tool in patients with suspected advanced lung cancer based on imaging to accelerate the time to treatment and to increase the proportion of patients accessing targeted therapy. So what we did in this study, we have our weekly rapid assessment program rounds at Princess Margaret, and what we did is patients in which we have suspicion for advanced lung cancer based on imaging. They were enrolled on the liquid biopsy study, and at the same time, while we were booking for the tissue biopsy, and they go through the usual standard of care workup and investigation for the suspected advanced lung cancer. We did liquid biopsy, and if we found molecular alterations, they were able to start treatment based on imaging, even before the tissue-based molecular profiling results were back. Our primary objective was to compare the time to treatment from referral to our weekly lung ramp to treatment initiation to an historical cohort from 2018. And the secondary endpoints were the proportion of patients accessing targeted therapy, and those are the results that we are presenting at this meeting. What we saw is that we enrolled 60 patients from July 1st, 2021 until December 31st, 2021. And we saw that the time from referral to treatment was 34 days in our liquid biopsy cohort from Accelerate, compared to 64 days in the historical cohort from 2018 using tissue only. So it's almost half the time. It's 1 month roughly compared to 2 months, statistically significant. And this is basically because of the median turnaround times of liquid biopsy. We use a 37 panel gene from Inivata in Vision First, and the median turnaround time was 7 days from sample collection to the results, compared to 26 days using a 160 panel based on tissue called Oncomine. And also, we have to take into account that liquid biopsy is minimally invasive. It's a blood sample which can be easily get, as opposed to the tissue biopsy that we have to book a bronchoscopy or a CT-guided biopsy. We have to find a spot for that, a slot for that, and that can take some time. So that would also explain that difference of almost the double, of almost 2 months compared to 1 month in time to treatment. We also look at the proportion of patients accessing targeted therapy. Of course, there are some limitations because in 2021 we have much more options, targeted therapies and clinical trials as compared to 2018. But we saw that in our cohort, almost half, 49% of the patients received targeted therapy, compared to 29% in the historical cohort from 2018. One of the limitations of this approach, this plasma-first approach, as comparing with the traditional sequential approach, is that, of course, some patients in which we thought they have advanced lung cancer, they finally did not have lung cancer. Right from our cohort of 60 patients, there were 10 patients with a different diagnosis. We had, at 10% is 6 patients with a different diagnosis. 3 had a diffuse B lymphoma, another one had a mesothelioma, one had a prostate cancer with lung metastasis. and we also had an ovarian cancer with lung metastasis. We also had a 12% of squamous cell carcinoma, another 12% of small cell lung cancer, and we know that in those tumors, molecular profiling is not as helpful for treatment decision making, but we had in total 60% of non-squamous non-small cell lung cancer, for which these results were very helpful to make decisions about first-line therapy.